conducted a series of interviews with health practitioners to further understand the intersection of climate change, health, and gender. The intersection of climate change and health is not gender neutral. The health burdens of climate change are not evenly distributed amongst different populations and are exacerbated by pre-existing vulnerabilities. On a global scale, women in particular are disproportionately exposed to and affected by climate events and their associated negative outcomes due to biological and societal inequalities.
Do you guys know that women are more likely to experience climate-related anxieties and depression levels, while disproportionately displaced by climate events and pushed into poverty due to climate crisis? The impacts are even more severe for women from marginalized communities who face overlapping inequalities from racism, poverty, and other factors.
Beyond this, women often lack adequate access and control over natural resources and decision-making power, which makes them more vulnerable to the impacts of climate change. To examine this intersection further, we interviewed health practitioners from a variety of disciplines to understand the role of the health practitioner in climate change and their knowledge of this intersection.
True or false? Extreme heat can lead to a higher risk of maternal death or stillbirth, which is made worse by disrupted health services during climate extremes.
True.
True.
That is true.
True.
Okay. True.
True or false? Women often bear a greater burden of care for sick family members, especially when climate-related disease increase.
Oh.
True.
Say true.
True.
Absolutely true.
True or false? Women and girls are more likely to experience climate-related anxiety, worry, and PTSD.
True.
True.
True. I guess
True?
true? The others are true? Yeah.
True.
True or false? Climate disasters can lead to increased rates of gender-based violence, including assaults, child marriage, and that are influenced and intensified by social and economic stresses.
It's true. True.
I also say true.
True.
True or false? Women and girls constitute a large majority of people displaced by climate change, which increases their vulnerability to health and violence.
Say true.
True.
Again, I would say true, yeah.
True or false? Women are often overrepresented in poverty, and this combined with social discrimination increases their vulnerability. Climate change also disproportionately affects women who lack access to resources and health care.
True.
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 False.
True.
Okay. Do you think that climate change is a healthcare issue?
I would say yes.
Yeah, definitely climate change is a health issue.
I don't think I would have thought it was a healthcare issue until very recently when we started to do a little bit more research and speak to individuals like yourself that are really involved in this area.
Becoming.
Yeah, it definitely has we have a role to play. Yep. It's not like we can't do like nothing. I mean, we're coming from like dietetics perspective back in food service, like in dealing with people like food, there's a lot of waste.
Yeah.
Especially with like supplements, like trade waste, and then like what do they do with that waste as well? There's a lot of waste from the food. But from a non-nutrition perspective, there's a lot of single-use like, plastics, like gloves, masks. I'm not saying it's a bad thing, it's just how it is, but like we do have a role. Maybe there's better things to have, or like different like standards or practices. When is it actually necessary to use those things?
I think with the variation in weather patterns, we can see lots of instances that can cause structural vulnerabilities for individuals, including like things like fire, flood, even extreme heat or extreme cold can significantly impact different aspects of health and ultimately potentially even increase the need for people to move away from spaces that they call home, which in itself creates a whole host of other issues and access considerations regarding healthcare.
I think it's going to be more at the forefront of healthcare than it was in the past.
I would say it's like a healthcare. If okay, let's just say right, it like affects your food production. You don't have enough. There's scarcity in that. In a country like ours, those people generally have to then seek medical help. So we inherently then take on more of that, I suppose.
Yeah.
Okay. Do you believe climate change is gender neutral?
No. Honestly, yes, but I wouldn't have before these questions have thought that.
Yeah.
No, I don't think it's gender neutral. I guess I would have said yes. 100%.
I think the research is showing that women are more affected by climate change.
And why?
Because it disproportionately affects women.
I think it exacerbates the inequities and the vulnerabilities that we already have and witness in the healthcare system. I think you mentioned some true false statements about women being at an increased risk for gender-based violence, but also having to experience exacerbated risk factors related to do with their health. It's in my mind, like climate change is like the earth, again, like very scientific, like that's what's happening. How does it affect gender? And I think also like being in Canada, I don't know, I think it's less obvious, like the gender, how there has a different impact on gender. But after like looking into it, yeah, kind of just like it's like, oh my gosh,
Like initially, my gut reaction was
Yeah.
no.
Yeah.
But now it's yes.
Well, probably because we're privileged to not have the
Yes.
the social factors,
Yes.
right?
Yeah.
Like if it warms up here, I have equal chance as any other male of surviving because I have independence and income,
Yeah.
Yes.
a family support system, which you don't think about as.
Due to lack of decision-making abilities, some of the policy makers.
In addition to the impact on women's health, climate change can also impact kind of the health of the males in the community. So especially if we're looking at closer knit communities that might be in a rural area with fewer resources, often men are tasked with protecting the community or mobilizing certain resources within the community to support that kind of mitigation of risk or harm to not only their resources, but also the people that exist in that community. And that in itself has dangers staying behind to support the mobilization of those resources.
What role does the health practitioner play in climate change mitigation and adaptation?
Education being a big one.
It's only very recently that I've even thought of healthcare practitioners being involved in healthcare in the climate change area.
yes to both the questions.
Knowing that women are greater affected means that practitioners, it's just an increased focus should be put on that population who is shown to be more vulnerable.
I think healthcare workers can be, first of all, just practice their due diligence in understanding how more proximal climate changes impact seasonal, I guess, patterns in patients, different types of comorbidities and mortalities that might impose itself, especially within our services, and making sure that our programs and current services that our system offers reflect the needs of a population at a given time.
In the realm of not necessarily in a hospital setting, but in like a primary care setting, or healthcare providers that like are in schools.
I guess, yeah, as a healthcare practitioner, it's like a day-to-day like tasks and activities, like even like the little things like planning, like, oh, I'm gonna do this, this, and this, so I don't have to change my gloves 3 times. Whereas if you didn't plan it, you just kind of do things without actually like thinking about it, like it might not be as efficient. So definitely planning to be efficient. However, I know that emergency management and planning can be really difficult, especially in the face of an emergency situation or an emergency climate change crisis. So just being aware of what those emergency protocols are, how to respond to them with the level of resources that we have, being aware of those policies and procedures.
Like public health sort of
Yes.
roles.
Yeah, I would say education is a big one for them, and the awareness of what supports they can refer people who are more at risk of this to get the supports to minimize their factors.
From an education standpoint, healthcare professionals can help with education, promoting, and advocating, especially for females that are affected by that.
There might be like different like malnutrition because all of such and such crop was wiped out for a year. So like that's more so nutrition, but like also I'm sure doctors will see different types of like illnesses come up. Water quality issues may cause an outbreak of different viruses. So it's just like those types of things too.
I think like just a minimal awareness of how that can impact individuals and families is really important. Even if you're not working in that realm of kind of disaster management, or even if you're not more close to that kind of impacting area, really approaching any sort of care that you're providing with person-centered care can actually allow that trust that I can identify some of these issues or concerns from families that might be facing the impacts of climate change. So I think that part is really, really important. And in terms of even just kind of that proactiveness, so I think considering, geographically we sit in a very central area, but our healthcare system supports a lot of families from rural and remote areas. So kind of almost anticipating that need for support, especially in Alberta, where we have lots of wildfires or potentially floods, and families might be displaced for long periods of time. Proactively seeking out how we can support them, especially for families that are engaging with the healthcare system more frequently, so especially chronic care or even prenatal care. So I think those pieces are really important as well.
And I also think it's very hard to get reliable information.
Yeah.
Outside of you can find whatever answer you want, you can find.
Yeah, that's true.
Right?
It's true.
Where if you can go to a reliable
True. Yeah, absolutely.
But also like I think if it's not necessarily down to an individual, it's sort of like a big perspective as well. Like telling your manager that you need this, or is there a different option for this?
Sure.
Like medication, like the containers or things, like gloves or like supplements, like things like that.
How do you think women's health is affected by climate change?
I would say a lot of it comes from how complex women's health issues are.
Well, just for no other reason, or the most obvious reason, just because of women's reproductive area.
Definitely when we look at kind of the role of women in families and households, a lot of it is caregiving and caretaking. So with the impact of climate change, whether it's increased heat or even like fire or extreme cold, all of these things, they kind of put more pressure into that caregiving role. Just making sure that families are taken care of and well supported.
We know that there's some greater risks associated with that. A lot of times too, women from other countries aren't as financially able to look after themselves and their family, and are more dependent on others, and they may not have the resources.
And with climate change being so much more of the forefront, we are learning how it affects the woman body that we didn't know 5 to 10 years ago, because it wasn't something that was as known or relevant.
Yeah, like the obvious effect would be fertility issues.
Right? Yeah.
Born with all the stuff you need to create a baby, and then influenced by, I guess, what's going on in the environment and pollution, temperature. I guess that could be for both parties.
And again, that can increase stress within the household, and as acknowledged previously, definitely with that increased stress can increase that risk of gender-based violence.
This intersection was a really novel topic for not only us as a team, but also to all the interviewees that we had. And this made for really some quite interesting conversations and some really good insights, and also provided some hope as the topic becomes more well-known and well-researched among health practitioners. So this podcast kind of style episode reminds us that this is still a really novel concept for a lot of people. especially working within the health sector. And we need to continue to encourage these conversations and surrounding these topics relating to climate change and health. And finally, we would love to thank all of the participants that made this podcast episode come to life, and all of their amazing insights and all the great conversations that we had as well.